Alright, this is the second time I recorded this video, and of course I feel like I'm being sabotaged, which is not out of the ordinary, but anyway. We talk about epilepsy.com as the source, and I'll be addressing partial complex seizures that don't exist, and the SUDEP, and I'll be addressing the eugenics applications of psychiatry for the New World Order. Now, we start off by talking about the tab of what if it's not epilepsy. It says, after looking at the test results, the doctor may conclude that the person has a medical or a psychological condition that causes events that look like epileptic seizures. So basically, they don't know what the hell they're talking about. They might later conclude that it's not even that after giving you these dangerous medications. We go to the next tab. Complex partial seizures. It says they last between 30 seconds and 2 minutes. Afterwards, the person may be tired or confused for about 15 minutes and may not be fully normal for hours. It goes on to say, what else could it be? Complex partial seizures resemble daydreaming or absence seizures. Okay, we go to the next tab. Well, the next tab that I saved. And we go to missed medication tab. It says, does missed medication cause seizures? Yes, it can. Missing doses of medication is almost certainly the most common cause of so-called breakthrough seizures in people whose seizures are usually well controlled. It says, go on to say, is it harmful to miss a single dose of medicine? It's quite common for people with epilepsy to miss a single dose once in a while. Often nothing bad happens, but your chance of having a seizure may be increased. So it has to do with the dosage, right? And it goes on to say, what will happen if I stop taking my medication? Choosing to stop taking your medication without a doctor's advice is dangerous. Abruptly stopping some seizure medications can cause withdrawal symptoms. So you could go through withdrawals, and then it goes on to say you could have prolonged tonic-clonic seizures, which are the seizures I believe do exist. Unlike these fairy tale fucking absence made up bullshit seizures like grand mal, absence, as well as complex partial seizures. And we go on to the tonic-clonic seizures that I were mentioned before, and it says, how long do they last? Generally 1 to 3 minutes. A tonic-clonic seizure that lasts longer than 5 minutes probably calls for medical help. A seizure that lasts more than 30 minutes or 3 seizures without a normal period in between indicates a dangerous condition called convulsive status epilepticus. This requires emergency treatment. Now, I will read the story this time. What are they like? Here's a typical story from a parent's view. These seizures frighten me. They only last a minute or two, but it seems like an eternity. I can often tell Heather going to have one because she acts cranky and out of sorts. It begins with an unnatural shriek. Then she falls and every muscle seems to be activated. Her teeth clench, she's pale, and later she turns slightly bluish. Shortly after she falls, her arms and upper body start to jerk, while her legs remain more or less stiff. This is the longest part of the seizure. Finally it stops and she falls into a deep sleep. Now, I go on to the next tab, which is the last tab I'll be discussing. I'm trying to wrap this up for 5 minutes, and it is the tab of SUDEP, sudden unexplained death in epilepsy. Okay, most people with epilepsy live a full and healthy life and should not spend time worrying about potential epilepsy-related catastrophes. That's because most people don't have epilepsy, they're simply daydreaming. You fucking asshole. Now, we'll go on to types of conditions causing increased mortality in epilepsy. Ordinary mortality from usual causes of death, death due to the illness that is causing the epilepsy, death from associated conditions such as depression, trauma, or drowning from seizures, SUDEP. Now we go down to SUDEP. It talks about who is at risk. SUDEP has been estimated to account for 15 to 20% of all cases of death in people with epilepsy. SUDEP is more likely in people with uncontrolled tonic-clonic seizures. Remember, that's the one that the seizure medications cause in the first place. Those who are having seizures but not taking adequate doses of anti-epileptic medications. Those who take multiple anti-epileptic drugs are at higher risk, but this may be because many who are taking multiple medications are having more frequent or more severe seizures, and this is the real risk factor. So of course they have their little excuse to downplay it because this is their biased epilepsy.com psychiatry movement, and they're only admitting what they really have to, and even that is enough to condemn the bastards. It goes on to say that seizures that occur during sleep may increase the risk. Males and African Americans may be higher risk. Many other factors have been considered, blah blah blah. So what are they telling us? They're telling us that they're killing us with this medication that they're giving us for things that they confuse for daydreaming, which just happens to kill black people at a higher rate and just happens to contribute to population control while filling the bank accounts of the scumbags. And the worst part is they're doing it legally and calling it psychiatry.